Doctors warned senior women that two everyday bathroom habits, so common they are almost invisible, are quietly responsible for persistent body odor in older women. The concern is not about cleanliness, laziness, or neglect. In fact, many of the women affected are meticulous about hygiene. The issue lies deeper, at the intersection of aging skin, hormonal change, and habits that unintentionally sabotage the body's natural protective systems. The realization struck Dr. Emily Rothman, a geriatric physician with more than 20 years of experience, during a routine home visit. The patient, Margaret, was a 71-year-old retired school teacher. Her clothes were freshly pressed, her hair neatly styled, and her home spotless. Yet the bathroom carried a heavy, sour undertone that lingered in the air. It was not the sharp smell of sweat, nor the obvious scent of uncleanliness. It was something subtler, thicker, and harder to define. Dr. Rothman had encountered it many times before, often in women past the age of 65, and she knew from experience that no amount of perfume or daily showering would fix it. Margaret was embarrassed when the topic came up. She showered every day, sometimes twice. She used scented soaps, feminine washes, deodorizing sprays, and fabric softeners. She scrubbed thoroughly, believing that if she just cleaned more, the problem would disappear. What she did not realize was that her efforts were actually feeding the very bacteria responsible for the odor. According to dermatological and gynecological research published over the last decade, more than 80% of women experience a noticeable change in body scent after menopause. This shift has nothing to do with being dirty. It is driven by declining estrogen, thinning skin, reduced oil production, and changes in the skin's microbiome. The body becomes far more sensitive to disruption, especially in warm, moist areas such as the groin and perineal region. Dr. Leonard Hayes, a microbiome researcher who has studied aging skin for over 15 years, explains that the skin of a senior woman is like a fragile ecosystem. When that ecosystem is stable, beneficial bacteria keep odor-producing microbes under control. But when the balance is disturbed, harmful bacteria take over quickly, producing gases and compounds that the human nose perceives as sour, musty, fishy, or ammonia-like smells. The first habit doctors warn about is overwashing the genital and surrounding areas, especially with soap, antibacterial cleansers, or feminine hygiene products. This habit is nearly universal among older women who are trying to stay fresh. It feels logical. If something smells, clean it more. But biology does not work that way. The external genital skin and the vagina are designed to protect themselves. The vaginal environment maintains an acidic pH, typically between 3.8 and 4.5. This acidity supports lactobacillus bacteria, which act as natural guardians. They suppress odor-causing microbes by producing lactic acid and hydrogen peroxide. When soap is introduced, especially alkaline or antibacterial soap, it neutralizes that acidity almost instantly. Dr. Nina Feldman, a gynecologist specializing in postmenopausal health, describes soap as a chemical bulldozer for aging tissue. In younger women, estrogen helps the skin and vaginal lining recover quickly from disruption. In older women, that recovery mechanism is dramatically weakened. Once the protective bacteria are stripped away, odor-producing organisms such as anaerobes move in and establish colonies within days. Research conducted at a Women's Health Institute in Boston found that senior women who washed the genital area more than once daily with soap had up to 12 times more odor-producing bacteria than women who used only water. Even more alarming, women who used feminine washes, douches, or deodorizing sprays had bacterial counts up to 100 times higher. These products often promise freshness, but actually raise pH levels and irritate delicate tissue, creating microdamage that bacteria exploit. Overwashing also dries the skin. Aging skin already produces less sebum, the natural oil that helps repel microbes. When soap removes what little oil remains, the skin develops microscopic cracks. These cracks trap moisture and organic material, forming perfect hiding places for bacteria. The bacteria respond to this hostile environment by producing stronger, more pungent odors as a survival mechanism. Many women describe a vicious cycle. The odor appears, so they wash more aggressively. The smell worsens, so they add stronger products. Over time, the bacterial imbalance becomes so entrenched that even frequent bathing cannot remove the odor because the bacteria have formed biofilms. These biofilms are slimy protective layers that adhere tightly to skin and resist soap, water, and even some antibiotics. Doctors emphasize that the vagina is self-cleaning. It does not need soap. It does not need fragrance. It does not need internal washing of any kind. The healthiest routine for senior women is surprisingly simple. Once daily rinsing of the external area with warm water only, using the hand rather than a washcloth. Washcloths can be too abrasive and often harbor bacteria themselves. If a cleanser is absolutely necessary, it should be pH balanced, fragrance-free, soap-free, and used no more than 2 or 3 times per week on external skin only. After washing, thorough drying is essential. Moisture is fuel for bacteria. Patting dry with a clean towel or even using a hairdryer on a cool setting can dramatically reduce bacterial growth. Women who made this single change often reported noticeable improvement within 1 to 2 weeks. The second habit doctors warn senior women about is wearing the same underwear too long or choosing materials that trap moisture. This habit is far more damaging than most people realize. Underwear sits directly against some of the warmest, most bacteria-friendly areas of the body. In older women, small changes such as mild urinary leakage, increased discharge, or sweating can transform underwear into a bacterial incubator within hours. Dr. Karen Liu, a textile health researcher, led a large study examining bacterial growth in undergarments worn by women over 60. Using DNA sequencing, her team discovered that within 4 hours of wear, underwear contained tens of thousands of bacteria per square centimeter. By the end of the day, that number often exceeded 100 million. These bacteria produced compounds such as ammonia, sulfur gases, and fatty acids, all of which contribute to persistent odor. The problem is compounded by fabric choice. Synthetic materials like nylon, polyester, and spandex trap heat and moisture while restricting airflow. Even underwear labeled as breathable often fails to dry quickly enough for aging skin. Cotton and bamboo, by contrast, absorb moisture and allow better air circulation, significantly slowing bacterial growth. Another overlooked factor is wearing underwear overnight. Many senior women wear the same pair from morning until bedtime, and sometimes even sleep in it. This means the skin never gets a chance to dry and rebalance. Studies show that allowing the genital area to air out at night can reduce bacterial populations by up to 80%. Laundry habits also play a role. Washing underwear in cold water removes only about half of bacteria. Fabric softeners leave a residue that traps odors permanently within fibers. Hot water washing, combined with enzyme-based detergents, is far more effective at breaking down biological material. Adding baking soda or white vinegar can further neutralize lingering smells. Doctors recommend changing underwear at least once during the day and again before bed, and immediately after any episode of moisture, even if it seems minor. For women with bladder leakage, this step alone can dramatically reduce odor within days. What surprises many women is how quickly the body responds once these two habits are corrected. Dr. Rothman followed up with Margaret 3 weeks after their initial visit. Margaret had stopped using soap on her genital area and switched to plain cotton underwear, changing it twice daily and sleeping without it at night. She also eliminated scented products entirely. The difference was striking. The odor that had lingered for years was gone. Not masked, not covered up, but gone. Doctors stress that aging does not automatically mean smelling bad. Odor is not an inevitable part of getting older. It is a signal that the body's natural systems are being disrupted. By working with the body instead of against it, senior women can restore balance, comfort, and confidence. The goal is not to scrub harder or use stronger products. It is to simplify, protect, and respect the biology of aging skin. When these two bathroom habits are corrected, the body often does the rest on its own. For senior women struggling with unexplained odor despite good hygiene, the message from doctors is clear. Less intervention, not more, is often the answer.